I help you?
Yes, hi, this is Lauren. I'm here for the tour.
Come on in.
Hi, Lauren. Welcome to the BirthPlace. Lizzie's here and is about to give you your tour.
So this is what a typical patient room looks like here at the BirthPlace. There's a bed, there's some sort of either couch or chair for a partner to sleep on or support person. When you first come to the BirthPlace, you'll be placed on the monitor so we can listen to the baby and assess how you and the baby are doing. And then depending on how your labor is going, what your plans are for labor, we may keep you on the monitor continuously, or we may be able to do what we call intermittent auscultation, which is where we listen every so often to the baby. All of our rooms have private bathrooms, and there's a shower with a little tub in each one. The showers in the rooms can be used not only for showering, but also for helping with contractions, because warm water can help soothe contractions. We have a chair that fits into the shower so you can sit while using that. We also have a tub in the tub room. If you're interested in using the tub, please speak to your midwife or one of the providers in the office about whether or not you're a candidate to use the tub. You'll also see that when you come in labor, there'll be a baby warmer in the corner, and that is only used rarely with births. Most of the time, once a baby is born, the baby's placed skin to skin with the mother to help the baby's adjustment to the outside world, keep them warm, and help promote breastfeeding if that's something that the mother plans to do. We try to keep the babies in the rooms with mothers at all time. We call it rooming in, also to help bonding and breastfeeding with the baby. As you can see, our OR is right down the hall if needed, whether that be for planned C-sections or for a more emergent C-section. We always have it available. And we try to perform what we call gentle cesareans, meaning if you have music that you would like in the background, you're welcome to bring music. We have the speakers in there. We encourage moms to be skin to skin with the baby once the baby's been assessed. So once the baby's born, you have the option for a clear drape. And what that means is once the surgeon is getting ready to lift the baby out, we drop one of our drapes so you can see the baby being born. And then the baby gets assessed over on the warmer, and then baby can come right to you assuming they are looking fine. You can have one support person in the OR with you up by your head, and the room will be, usually there's a doctor and a midwife assisting the doctor, and then an anesthesiologist present in addition to a few nurses. We also have 24/7 anesthesia coverage here at the BirthPlace, so if you desire an epidural or if you need a C-section for whatever reason, the anesthesiologist is always available. We also have plenty of non-pharmacological options, meaning you can use a tub, like I had mentioned before. We have hot water, and our nurses, midwives, and doctors will all help you get through your labor if that is something you want to do without medication. We also have some equipment available to help you labor, some of which are a birthing ball and a birthing stool. We also have a mirror available to if you would like to watch your baby being born or while you're pushing. We also have something called a peanut ball, which we can use for helping position women when they're in the bed to help the baby rotate through the pelvis and get into an ideal position. We also have what we call a squatting bar. It's a bar that hooks onto the bed that we can reposition to help women push. And we can tie a sheet to it and have someone pull on it. We can also help them reposition their legs to be able to push in labor. We also have a continuing care nursery here on the floor, and that is a place where babies who might need a little bit extra help postpartum can be placed. It's staffed by nurses and then a neonatologist who is always available. So the BirthPlace doesn't have any set rules about visitors. You are welcome to bring as many people as you would like. However, we would like to keep the environment safe, so as long as the provider and nurses can get to the woman in labor, that's fine, as long as everyone can be present safely. There also are no set visiting hours. The only thing is our doors of the hospital lock after 9 p.m. So if anyone comes to visit after 9 p.m., they're going to have to come through the emergency room, and everyone that comes to visit has to be buzzed in at the front. If you are a patient at our practice, feel free to ask your provider at your next visit on how to go about scheduling a tour of the BirthPlace in person. If you are not a patient of ours and would like to become one, please call one of our office locations to set up an appointment.